everybody lives long enough, they will develop a cataract. A cataract is a cloudiness of the natural lens in the eye.
As the cataract develops and becomes more severe, it does start to affect your vision by blocking light from coming into your eye.
People start to notice that they're not seeing well enough to read fine print, or in low lit situations they have a harder time maybe finding their seat in a movie theater, or driving at night with the glare from headlights. And so they'll start to have complaints from that decreased vision that happens over time. It's very common, it's very slow growing.
And as it gets more severe, then the cataract starts to affect your vision even in good lighting. A common scenario with worsening cataract is somebody noticing that their glasses just aren't working well anymore. And sometimes that's because a change in the glasses is needed. Sometimes it's because a cataract is blocking your vision.
The average age of cataract surgery is 73 years of age in the United States. Once the cataract progresses to a point where it affects the vision enough, then cataract surgery should be considered.
There are other conditions in which if you had trauma or certain medications or certain medical conditions where you can get a cataract earlier in life. We've taken cataracts out from infants and teenagers in every decade of life. I think my oldest patient was 104 and I took her cataract out.
Cataract surgery involves removing the natural lens in the eye and replacing it with a clear plastic artificial lens. What we call a standard lens, which is covered by most insurance plans, will focus the eye for one distance. So patients either choose to have good distance vision or good near vision. If they choose good distance vision, then they will most likely need reading glasses to see up close afterward. If they choose near vision, then they would need glasses for distance or driving. If they have a certain degree of what we call astigmatism, which is just an irregular shape of the surface of the eye, you can choose to place an astigmatism correcting lens or a toric lens inside of the eye, which will correct for the astigmatism at the time of surgery. That is an additional out-of-pocket expense which insurance does not cover. There are also multifocal or advanced technology lenses available that allow the patient to have a broader range of vision.
So recovery from cataract surgery usually is very simple. Most people the day of surgery, their vision is blurry and their eyes a little bit scratchy. And usually they wake up the next morning and they're seeing more clearly and they feel normal. They have to take drops for a couple of weeks. They have to be careful and guard the eye for the first week or so. We have them wear a shield to cover their eye at night for the first week. But most people within a few days, within a week or so, are back to their normal activities and enjoying their better vision.
We do offer consultations for cataract surgery at Utah Valley Eye Center. If you're noticing any trouble with your vision at all, I recommend scheduling a consultation so that we can evaluate not just cataract, but if there's any other disease that could be limiting your vision in your eye.
Cataract surgery carries risks, and those risks can include bleeding, infection, loss of vision, need for an additional surgery. The risk of infection is estimated to be approximately 1 in 1,000. And so it's extremely rare that somebody would develop an infection after cataract surgery. If recognized quickly enough, that can be treated with antibiotics.
Once you remove the lens for somebody's eye, it never comes back again. And so that lens that we put in there is in there for life. You can occasionally have a film that develops behind the lens, and a lot of the symptoms will return. People will have that glare again and the blurriness, but they're quick to recognize it and they come back in, and often with a quick laser procedure we can touch up the cataract surgery and they should be good for life. It's pretty amazing.
I think Utah Valley Eye Center is a great place to pursue all of your visual needs, including cataract surgery. We have several excellent surgeons here, all of whom are well-trained with many years of experience with routine and complex surgery. We have kind staff members, from the receptionist that you meet at the door to the technicians that help with your testing to the staff that we employ over at the surgical center. I think that you will have a great experience with any type of vision care, but especially surgical care at Utah Valley Eye Center.